Maybe I think we're about ready to begin. I know we're going to need all the time that we can get for tonight's presentation. So why don't I begin by welcoming you to Thrive Talks. I'm Steve Parker, chair of the Program Development Committee that has created this series and board member of Thrive, which is the community mental health center serving the towns of Oak Park and River Forest here in Illinois. Tonight, we kick off this year's series with an extremely important and timely topic. We are living in extreme times. In addition to the familiar stresses of modern life, the pandemic and the divisiveness in our culture have added a layer of stress and anxiety that is affecting the mental health of so many people. Tonight, our panel of experts will demystify how, when, and where to seek professional help. I'm excited to introduce you to our panel. Dr. Heidi Hammernick is a former board member of Thrive. We had a chance to serve together for many years, and we continue to serve on as she is still a member of the Program Development Committee. And also, Heidi, you've been extremely generous with your time in presenting talks each year for this series. Heidi's a licensed,
it's a delight.
Heidi's a licensed clinical psychologist in private practice who specializes in working with children, adolescents, and their families. Her work includes pediatric neuropsychological assessments. She specializes in helping those with neurodevelopmental disorders and challenges with emotional regulation. She also has a great deal of experience working with people on the autism spectrum. Welcome back, Heidi.
Hi, thank you.
Daisy Rios. Daisy and I had an opportunity to work together in supervision groups at Thrive, and I know how terrific she is. Daisy's a licensed clinical professional counselor who serves as the manager of youth services at Thrive, overseeing the youth therapy team, which I believe is 6 therapists that she oversees. Daisy has worked with adolescents, adults, and families who experience trauma, anxiety, depression, and life challenges. She has specialty training, which I love, in areas of domestic violence, trauma-focused therapies, and anger management. Welcome, Daisy.
Hello, everyone.
And Dr. Alexandra Luger, who arrived from New York, and I liked her immediately because I didn't have to explain my New York accent to her. And as soon as she arrived, she immediately began contributing to our community by becoming a board member of Thrive and a member of our Program Development Committee as well. She's a licensed clinical psychologist in private practice who is fluent in Spanish. She specializes in working with individual adults and couples. Her areas of expertise include people struggling with major life transitions. She works with couples dealing with issues of perpetual conflict, disconnection, sexual dissatisfaction, and infidelity. Welcome, Alexandra.
Thank you.
I just want to say that people should feel free to submit questions into the chat room, and we will hope that there is enough time to answer everyone's questions. And so at this point, I'd like to turn the show over to Alexandra.
Thanks, Steve. Welcome, everybody. So for today's presentation, we will be talking about mental health care. The title for today is Where to Go When All You Feel is Lost, a blueprint for mental health care. So before we get started, let me give you a bit of a roadmap for what to expect. We're going to be talking about 4 major areas. We'll start by understanding when it's the right time to seek professional help. I'll talk a little bit about adults seeking professional help, and then Heidi will talk about children and adolescents. We will talk about the different levels of care and some of the many types of treatment that are out there. We'll briefly talk about knowing where to access referrals, what the first steps are to seeking help, and also a basic understanding of how to finance sessions. So before I jump into when to seek help, I'd like to make a note about stigma. So more than half of the people with mental illness in the US don't receive the help that they need for their conditions. So a person struggling with mental health might ask themselves, is this issue big enough to merit professional help? Isn't this something that everybody deals with? Shouldn't I be able to deal with this on my own? What will people think if they find out I'm in therapy? Or my personal favorite, I tried it once, it's not for me. In the US, shame, prejudice, and discrimination against people with mental health conditions has gotten much better in the past 50 years. So you'll see billboards on the side of the highway for national suicide hotlines. You'll see commercials on TV for different types of therapies that you can receive, or celebrities disclosing on disclosing on social media what their experiences with mental health have been. But you might be surprised how prevalent mental health stigma still exists in our communities. I can't tell you how many people I've spoken to who, in theory, are very much in support of people getting the help that they need for their mental health care. But when it's time for them to seek help for themselves, they will come up with a laundry list of reasons why it's not the right fit. And there are all kinds of good reasons why there is this stigma. You know, we may have grown up in a family where emotions weren't really talked about, or talking about emotions was seen as complaining. There may be a distrust in the medical system, and mental health care being a part of that. Regardless of the reason, unfortunately, mental health stigma is still alive and strong in our communities, and it perpetuates a lack of understanding for what the vast spectrum of psychological disorders looks like. So it's actually quite rare that mental health looks like the person on the street who is asking for money and talking to themselves. Mental health issues touch the high functioning, the externally very put together person, the academically successful or professionally thriving person. Even somebody who smiles a lot could still be suffering from mental health privately. So that's what we're here to talk to you about today. Hopefully to demystify this mysterious field and help you or somebody you know get the help that they need. So when to seek help for adults? It can be very confusing to be guided by diagnosis when it comes to mental health. So we don't use blood tests or MRIs to diagnose psychological conditions. Instead, we interview our patients or their loved ones to capture their level of distress and dysfunction. So we ask questions about mood or what emotions a person experiences, what sort of thought patterns they have, and if they have certain of the same recurring thoughts, and how a person navigates their world. What are their relationships like? What's their ability to accomplish their daily responsibilities? And so what ends up happening is psychological diagnoses are constellations of symptoms. And that means that two people suffering from the same psychological condition could present very differently. So for example, you might say, I have an uncle who was depressed and he cried all the time, and I never cry, so I must not have depression. So again, it's confusing to be guided by diagnosis. So if you have one already, great, that's a great first step. Maybe your primary care doctor gave you a diagnosis, or you went to therapy a long time ago and they told you that you might suffer from generalized anxiety disorder. But if you don't, my suggestion is to avoid going online and trying to self-diagnose, and instead be guided by 5 primary factors, which I'm about to talk about. So they are distress level, problematic patterns, disconnection from self or others, a change from baseline functioning, and the inability to enjoy. So let me talk a little bit about each one of those. So psychological distress describes the unpleasant feelings or emotions that we may have when we feel overwhelmed. Psychological distress could look like or feel like fatigue, sadness, irritability, angry outbursts, anxiety, fear, moodiness. So it's basically when we're faced with stressors we can't cope with, like traumatic experiences, major life events, a pandemic, or even everyday stressors like workplace or family stress. Next, problematic patterns. So this is a very broad topic, but for this category, I want you to be guided by patterns of behaving or thinking that you worry might not be good for you. So this would include patterns, for example, of eating or drinking to self-soothe, avoiding certain people or places to avoid unpleasant feelings, and also recurring thoughts that we simply can't get out of our heads and make us feel badly. Connection. So somebody who's struggling with a sense of disconnection from self or others might say to themselves, I don't know myself, or I'm just not the person I used to be. or the closest people in my life just don't know me. So this is a really timely topic, given that we've all been probably more isolated than ever from the pandemic. So there are a lot of people struggling with a sense of disconnection from self and from others. Other signs that it's the right time to seek professional help. If you notice a change from your baseline functioning. So as an example, let's say that you used to love to read novels and you can pour through your novels in a couple of days. And suddenly you find yourself unable to get through a single page in a day. That's an example of a change from baseline functioning. Inability to enjoy. So let's say that you used to love to call your friends during your lunch break. It used to energize you and help you get through the rest of your day. And now all of a sudden you're finding the task to be really tedious and you dread it. And it's just not enjoyable anymore. That would be an activity, or that would be an example of not enjoying the things that you used to enjoy. Also, don't forget substances. Substance abuse absolutely falls under the umbrella of mental health care. So you may be recommended to seek medical care in conjunction to psychological care in order to manage your treatment. But substance abuse absolutely falls under the scope of mental health care. And of course, the more serious signs as well. So if you're experiencing suicidal thoughts, panic attacks, if there's self-injury like cutting or burning or headbanging, and if you experience mania. Okay, I'm going to turn it over to Heidi, who's going to talk a little bit about children and adolescents.
Hi, everyone. So as Alexandra just pointed out, one of the main differences too about adults versus children is adults can express with their language what's going on. Children, especially those that are younger, aren't going to come up to you as a parent, mom and dad, especially like under 5. I'm very worried. I think I need to see a therapist, right? We're not going to be able to, they're not going to be able to say those kinds of words. But what we will be looking at is their behaviors and how they play and how they interact with others. So I've grouped things into children under 5 and middle-aged school kids, and then we'll go up to adolescents. When we look at children under 5, things that may be problematic, and again, this is all on a level of intensity, frequency, and duration. Most of these things that you will see listed under here, every child is going to display at some form or another, or at some time or another. That is very normal. But if it tends to be intense, if it is it consistently occurring over weeks at a time, the frequency of it, and are they lasting a long time, and is it affecting their functioning in school and with friends? So with those caveats, let's look at this a little bit. If a child's overly clingy to their parents, if they're very tearful and crying, if those tantrums are happening all the time and it's over small things. Physical complaints tend to be a big one, because as children, either under 5 and even older children, they're not able to express themselves, but the body keeps score. And they may actually feel a stomach ache or have headaches that are occurring. Things that we definitely for under 5 is these regressive behaviors. And what that means is that if a child is returning to an earlier form of a behavior that they have already been through or completed and have met that developmental milestone. Ones that we see typically if a child is under distress is bedwetting again or thumb sucking. Another thing that you may see is you see crisis themes in their imaginary play. Children express their feelings through their play. That's their stories that they create in their mind, and these come out in their play. And it helps them to gain a sense of control and to understand how certain events are happening in their life. So if for some children who have lived through some kind of trauma or crisis, they may play this over and over again. And if it's something that is sort of out of the ordinary or doesn't seem to be going away, and their functioning is also impaired, meaning maybe their sleep or their eating, or they're not wanting to be around other people, that's when you might want to seek assistance. They also may become oversensitive to noises and obviously difficulty with changes in any routine. And as we move up here into children between the ages 6 and 11, obviously school starts to come at this time. And children who are struggling, are anxious or worried or depressed, may not want to go to school, or if they're worried about something. And we definitely have seen an increase in this since COVID. Nightmares, if they're distancing themselves from people, again, an increase in irritable and anger, and those physical complaints. We also tend to see more memory and concentration problems here. They may not be able to focus within the classroom or to handle what's going on around them, or they're easily distracted. They may ask for constant reassurance. Is this okay? Is this okay? Am I going to be okay? Or maybe they can't make a decision about things, again, in terms of if it's frequently or with duration. They may not want to talk, or they may lose an interest in those activities they've always enjoyed. Okay, next slide, please. When we come to adolescence, we tend to see some of those same things as we did with the younger children, but the social realm and the social domain becomes more important at this time. So for kids who are not wanting to hang out with their friends and are avoiding their social commitments, that's when we may become a little bit more concerned. Definitely may see more eating problems or concerns about their body, especially as they go through puberty and they have experienced those different maturational changes in their body. We definitely may see an increase in drug and alcohol abuse, losing interest, school refusal again, or mood swings or destructive behavior. Now, I get a lot of times will be like, well, my teenager is being uncooperative and they don't want to do what I say. That doesn't mean necessarily they need to come into therapy. Now, a lot of times those are normal behaviors. However, what happens is, again, it's that intensity, frequency, and persistence over a long period of time. And if they're not speaking to you about this, or a trusted other adult in their life, that's when you may want to seek help. Now, usually I say this is just a very generalized benchmark, but for any of these problems, if they're going on longer than 4 weeks, then that's something you may want to consider in terms of seeking for help, with the exception being, if there's any harm to self or to others, that's definitely a time where you want to seek immediate care. And always, your child may not tell you something is wrong. You may need to look at their behaviors, to listen to them, and to check in with them on a frequent basis. Okay.
Thanks, Heidi. And now that we've learned a little bit more about when to seek care, let's kind of look at where to seek care. So really the most common form of care is outpatient services, and really looking at where to access outpatient services to address some of these concerns that you might be seeing either in yourself or in your children. And when we look at outpatient services, those can be community mental health centers such as Thrive Counseling, private practices, local community nonprofits sometimes have a counseling component attached to their business model, behavioral health centers, and then hospitals. And when we look at these levels of care at outpatient services, there's a wide variety of things that you can access there. So we can do various types of therapies. So individual, group, family, couples, crisis services, even walk-in services. So that removes a commitment of being in therapy, and really sometimes we just need support in that moment, and that's where walk-in services can come into play. We have intensive outpatient programs, or IOPs, and partial hospitalization services, which are similar to like a day program where you go, you get the more in-depth support and counseling needs, and then you get to go home at the end of the day. And then we have medication management. So in outpatient services, we can start to address some of these concerns that you're seeing in yourself or in your children. Next slide, please. And then in addition to outpatient services, there's access to inpatient services. So when we look at inpatient services, we look at more intense care, more consistent care. So maybe these might be moments where you are not going home at the end of the day and you're spending most of your time at the facility where you're getting the services. So these might be hospitals, behavioral health centers, or even residential facilities in times of real deep support. And the services provided in these areas can be residential long-term stays, mental health crisis emergencies, hospitalization, even counseling services. So in inpatient services, there is some overlap in what type of support you can seek. And then medication management. So we want to make sure that these areas and this access to services are well-rounded and you're able to get what you need in your plan of care. Next slide.
Okay, I'm going to briefly go over just some types of treatment, and mine is going to focus, I have a child and adolescent focus that I'll be covering here. Now, each of these different types of therapies can include components of play, conversational, or what people call the talk therapy, cognitive behavioral intervention, and Daisy's going to go into more of that. But it can also occur here with these different types of therapies, skill building and education. So I just wanted to give a very quick breakdown of what this is. In terms of individual therapy, there may be play therapy, and this can be for children, although not always. There are types of play therapies for adults, including Jungian therapy. They do sand tray therapy. But basically, play therapy involves as a way for a child or an individual to express and communicate their feelings through the play. All right. And it can be a very unstructured or a structured situation. Other times, and especially working with children and adolescents, the therapist may play with the child while they're talking about their concerns. So a lot of times a parent, if they're in a session or watching their kid with the therapist, they may see the therapist and the child are playing a game, or the child comes home and a parent goes, "What did you do in therapy today?" And they played Uno. Well, that's not all that's going on. But that's how we connect with kids, because that is their form of communication at that point. That's where they feel comfortable. And we as the therapist need to meet them there. So, and there's times where they just need to be involved in moving in something, and that helps for communication to come through. The other type of therapy in individuals, that conversational, and that's when you may hear a lot of the classical, tell me more. How does that make you feel? So those are some of our classic go-to sayings that we use. We do that in order to understand how the client is feeling. But basically what we're doing in that type of therapy isn't just letting you only talk. We are examining patterns and emotions, behaviors, and social relationships and discussing these concerns. And these are some of the types of therapies that may go along with that. Psychodynamic, psychoanalytic. In a psychoanalytic therapy, you're going to be seen more than once a week. It's typically 4 to 5 times a week that you are in therapy. In terms of cognitive behavioral, this is focused on specific changing thoughts and behaviors, which Daisy will cover in a few minutes. The other one I want to go over is family therapy. And this is a focus on those family relationships and behaviors within the family system that are contributing to the development or maintenance of certain patterns within the family. So we may look at, whoops, that's okay. Thank you. So what we may do is we may look at, well, what is the couple system doing? How do the couples interact with certain family members or the sibling subsystem? So we're going to be looking at what are those patterns within that family. Now, there are also very specific types of family therapy, and some of these have a more behavioral or cognitive behavioral bent to them. PSIT, or parent-child intervention, is a very effective therapy, typically for ages 2 to 7, and they work with disruptive behavior challenges. And there's another one called ABA, or DIR floor time. And these are typically for children who are on the autistic spectrum to help in gaining better control over their behaviors. And then there's something called filial play, smart love therapy, which focuses on attachment and a caregiver's and emotional well-being. Okay. Again, this list is not exhaustive, but I wanted to give you a flavor of the different types of therapies out there under individual and family. Now, another question I get a lot of the time is the difference between psychology and psychiatry. And what that tends to be the difference is a psychiatrist can prescribe medications. They have a medical degree. So they can prescribe medications in addition to providing therapy. Now, not all psychiatrists will provide therapy. Some choose to focus on the medications, but mainly they have training in both areas. The psychologist is trained in assessment, psychological assessment, as well as therapy. And that includes social workers, marriage and family therapists. Those all have the training in that area. And the last one, the new come onto the scene, is telehealth. And that's been a big godsend for many people in the sense that they've been able to keep in treatment, especially over the pandemic time. Okay. And Daisy's up.
Thanks, Heidi. So Heidi mentioned a little bit about the cognitive part of therapy and really having an examination of what our thoughts do, what are they telling us, how are they making us feel. And one type of treatment is cognitive behavioral therapy, or otherwise just shortened as CBT. And with the CBT approach, we can use that with adults, with some older children, and we really look at the connection between thoughts, emotions, and behaviors. Because not a lot of people understand that this is a very bi-directional process. So that really our thoughts can impact our emotions, which can impact our behaviors, and vice versa. It really does happen in a cycle. So CBT really looks at what those thoughts are with the intention of being able to influence some of these other areas. And with CBT, we identify the distressing thoughts. We work to change negative thinking patterns. So really using a lot of different methods, including reframing and restructuring, to really think, how can we say this in a way that is supportive for us, and in a sense, giving us some hope that we can move forward in our process. And some of the most common uses for CBT include depression, anxiety, anger management, OCD, or obsessive compulsive disorder, and post-traumatic stress disorder, or PTSD. So with cognitive behavioral therapy, or CBT, there are those 5 interconnected components that we would look at. And those are the situation. So what happened? Tell me what happened, right? The thoughts behind what happened, the emotion. So how did that make us feel? What are the physical feelings? Sometimes we have physical things that happen, just like we mentioned earlier, our body keeps score. So what are some of the things that are happening in our body to let us know that this is something we should pay attention to? And then what are the behaviors? How is this influencing the actions that we take? So that's something that CBT looks like, and something that we work with in session to examine and help with the process. Next slide. So similar to, well, not similar, but born out of CBT is something called DBT, which is dialectical behavior therapy. And this therapy is a bit more structured in the sense where we look at very specific areas of ourselves. So we look at regulating our emotions. How do we cope with stress? Learning critical thinking skills, which is something that doesn't come easy to everyone, and that's okay. We work in session to advance that process for you. Building connections. What do relationships look like? What do they mean, right? And some of the most common areas that we use DBT would be for anxiety, borderline personality disorder, suicidal ideation, eating disorders, OCD, and PTSD. So there is some overlap between DBT and CBT and what it can address as far as mental illness. However, their processes are different. So when we look at the 4 main areas of DBT, we look at mindfulness. So how can we slow ourselves down so we can be present in that moment? We look at distress tolerance. So how are we able to deal with some of these things that are happening for us? Interpersonal effectiveness and emotional regulation. So how are we able to assert ourselves and really address the needs that we have in an environment where so many other things are happening? So that's part of what DBT looks like. Next slide. Thank you. And the last one I wanted to focus on was which is in the name, solution-focused therapy, or sometimes solution brief focus therapy. So what this one is, it's a very specific short-term therapy that really looks at what is happening in the moment. So it aims to lessen the impact of the current problem. So exploring how do we create change, identifying what works and what doesn't work. A lot of times people like to focus on what doesn't work, right? And really mentioning, well, I've tried this before, I've tried that before, nothing works. Well, we really want to look at what has worked. What has happened for you that we can use in this process? And some of the most common areas that we've used this is depression, anxiety, self-esteem, and life transitions. Because a lot of times life transitions can have more of an impact on us than we really want to give those transitions credit for. So really looking at what is the problem, what is the issue, what is happening for us. So when we look at those main areas of focus, we have to understand a couple things. Change is certain. That's inevitable. So we focus on what can be changed, right? Client's desire to change, that's really important, because us as therapists, we want to make sure that you're in a place where we're ready to do this work and go on this journey together. And if there's something that we need to explore beforehand, then that's really important too. We want to look at the future. So solution-focused therapy really does look at how do we move forward, identifying resources and strengths, and really finding out what are those for you, right? Because they can be protective factors and we can use them. And overcoming problems and obstacles. So that's really the focus of solution-focused therapy, is how can we get from where you're at to a more comfortable space and lessen that impact of what is happening for you.
Okay, so I'm going to talk a little bit about 2 other types of treatment, group therapy and couples therapy. So both of these treatment modalities have a lot of stigma and misunderstanding surrounding them. So I've heard comments like, group therapy is for people who are really messed up, or couples therapy is only for married couples who are on the brink of divorce. Both of those are wrong. So starting with group therapy. Group therapy is a primary treatment intervention. It's highly effective. Its efficacy for the treatment of psychological conditions has been widely researched. So there are 2 main types of groups. They're process groups and support groups. So you're probably more familiar with support groups because that's generally what's depicted in the media, and it's what AA and NA are. So in a support group, typically there's 6 to 10 people, but the size can vary. People are meeting in this group around a particular topic. So for example, it could be a grief group or a substance abuse group. And there's a group facilitator that will give information about whatever the clinical topic is for that group. They'll provide coping strategies, and the group participants will have the opportunity to share their experience of dealing and coping with whatever the topic is. Then there are process groups. So process groups are a little bit different. Process group, everybody participating is looking to improve something about the way that they engage relationally. So not all members are going to be in the group working on the same thing. So you might have somebody in the group who is very shy in their relationships and they're working on that. You might have a monopolizer, somebody who takes up a lot of extra oxygen in their relationships. So the whole idea is, in a process group, you meet with, and again, it's 6 to 10 participants on average. You meet with the same group members every week, typically for 90 minutes. And with time, you start to build a rapport with the people in the group, and your dynamics outside of the group start to present in the group. And the very things that you're wanting to work on will start to unfold in the group. And here's where you'll have the opportunity to get feedback on how you're coming across, and you'll be able to practice different ways of engaging relationally. A question that comes up a lot when it comes to group therapy is it private? Is it confidential? So of course, the clinician is bound by HIPAA standards, and they absolutely keep everybody's identity private. Now, the other participants are not bound by HIPAA, but privacy is taken really seriously in group therapy, and it's always talked about at the onset of a group starting, and everybody promises to keep the identities of everybody else in the group confidential. And now couples. So couples come to therapy at any stage of the relationship. You do not have to come to couples therapy if you are on the brink of divorce. That's not the only reason. In fact, you don't even have to be married to come to couples therapy. So couples come for a variety of reasons. For example, the anticipation of a major life transition. So maybe your last child is going off to college and you're going to be empty nesters, and you think that's going to be a tough transition for you and your partner. If there's increased conflict or distance in the relationship, if there's an infidelity, some couples come because they want to improve communication. Another common issue is couples coming to therapy because they're misaligned in one particular area. So perhaps parenting, or how to handle finances, or social life. Couples therapy can also be an incredibly useful tool in maintaining a healthy relationship. So I think most of us know relationships, romantic relationships, could be one of the most fulfilling parts of life, but it can certainly also be one of the most challenging parts of life. So this is a space where you can come and learn some basic skills about how to be a good partner, how to communicate well with your partner, how to resolve conflict, how to reach compromise, right? These are skills that we often don't learn in school. It wasn't part of my health class, but are critical to having a healthy relationship. So again, there are all kinds of reasons to come to couples therapy, and you absolutely do not have to be married in order to come to therapy for couples. Okay, back to Heidi.
Hey, thank you. So I'm going to describe just real briefly a little bit about the therapeutic process. A lot of questions, especially when I'm working with children or young adults. It's like, well, what do I do when I go? What's it like? So now again, of course, it depends on the type of therapy. And Alexandra just gave a very wonderful explanation of how it may work in the group therapy process and building rapport. But in other types of therapy, whether it be cognitive behavioral, individual, or family, typically when you first go in, the therapist is going to do some type of assessment. Now, that assessment can either be formal, informal. Informal is more of they're going to ask you questions about different parts of your life, get a history of certain relationships. If it's more focused on a child, they may look at what were the developmental milestones, what is their behavior like in school. If for young children, when I'm just assessing them, I may look at their play. So when I'm engaging them within play, I maybe see, are they playing with me? Are we interacting together? What is their communication style? So these are the kinds of things that we would at first look at. And then the other part, in terms of a formal assessment, a therapist may give you certain questionnaires to fill out regarding feelings, thoughts, or behaviors. And it can also be, if you go for a neuropsychological assessment, where you may want to have to see if your child or the adult has ADHD and an inattention disorder. Do they have some kind of dementia or Alzheimer's? So those would be your more formal objective assessments. Then after that assessment process, what we do is then we look at building that relationship and trust, although that starts even at the beginning when we're doing assessment, but we want to build trust and getting to know the client and helping them feel secure so that they feel that they can open up here and that it's a safe space to do so. There may be goal setting and psychoeducation that are involved, depending on what the client needs and the type of therapy. Some therapies don't engage in goal setting. Then we move toward gaining a better understanding of working with you as the client of what's maintaining your feelings and behaviors and relationships, what's getting in the way of what is having you a more fulfilling or a happy life. And then we may start into those conversations or get into that other therapeutic process and cognitive behavioral therapy. And the other part I want to say is in terms of that family as a very important part of the therapy, especially with children. So it's not a matter that dropping off your child and having the therapist just work magic and then they go home. No, you as that family and as the parents are a very important piece of that therapy. Okay, next slide. Other considerations that are important in therapy is that you may feel worse before you feel better. I know most people want to come in and say, I didn't feel better. They brought up all these negative feelings and I just feel really bad. Or my child, I did what the doctor said and their behavior got worse. What's going on? This isn't working. Well, this is a very normal process, and that sometimes therapy brings up negative emotions that sometimes people have been avoiding or not wanting to work through or to address. And that's okay. That's a very normal process. And we're here to help coach and guide them through these negative feelings or internal states to get them to a place to start feeling better. And the same with behaviors, say, of children and adolescents, that there's times where they're going to be testing you and that they're going to see, does my parent mean what they say? So sometimes their behavior will actually get worse before it gets better. Now, therapy can be a longer or shorter process depending on the challenges presented. And you may go in and out of therapy. At one point, you're like, I think I'm okay right now. And that will be a discussion between you and your therapist. And there may be a time that you may want to come back, which is a very normal process too. Things I do think that are important to watch out for is please fix me or please fix my kid. And while we all wish we may have had a magic wand just to make everything better, therapy is work and looking at how to work on changing things, not doing things in the same way. And we want to watch for therapy not being framed as punishment. That if you don't behave right now, you're going to go to therapy. We want to have therapy as that safe space for kids or for whomever it is that they may be working with. And we also want to watch out for therapy not putting out fires. That means not only coming into therapy when there's a problem, because what happens is you never get to address what is maintaining those problems or issues. And by being in the therapeutic process on a consistent level, whatever that may be between you and your therapist, that helps to get to some of those deeper issues. Okay, next slide.
Thanks. Now, one of the things that people do often have some worry about or some questions on how to navigate is the cost of therapy, and that can weigh heavy on some depending. And with therapy, there's an in-network and out-of-network cost. So usually in-network is when you work with your insurance company to go to a provider that is approved. And in-network can usually equal a lower out-of-pocket cost for you. And out-of-network is when you go to a provider that is not listed with your insurance company. So that could equal a higher cost to the person. Out-of-pocket is a way to finance therapy, and that would equal full price. We also have sliding scales, which would be a according to income. And a lot of places do have that for underinsured or non-insured clients who are seeking support. Some of the challenges that we have with using insurance is, unfortunately, sometimes there is a wait list in some places, some high deductibles. If you have an insurance that says that you have to pay a certain dollar amount before things are covered at your benefit percentage, therapist turnaround, session limits or infrequent sessions, and limited access to providers is a big one. So at Thrive, I wanted to talk about some of the things that we do for cost. So at Thrive, we accept many private plans and we accept all Medicaid plans. We work with people to create a plan of care that's worked for them, even from the financial piece. We have a range of therapists for both adults and youth. So we start seeing our youth from the age of 6 to 17. And then we have our adult program, which is 18 plus. So it goes all the way up. Even seniors are able to get support from us. We have many different mental health areas that we cover. We have case management, psychiatry for medication management, and we work with people on their financial plans. So we really don't want anybody to shy away from services based on the financial piece. We always encourage people to call us and see what can be done. Because the way that we feel, you always ask. You always want to ask the question because you really don't know what you're going to get unless you ask, right? So we really want to be able to have open communication, not only with our clients, but with those who are calling us to ask us about our services. Next slide, please. So the last thing that we want to talk about, and kind of like coming full circle with this presentation, is culturally sensitive care. Just like knowing when to seek therapy, where to seek therapy, how much it's going to cost, what it's going to look like, we want to look at identities and really the importance of finding a therapist that fits your needs. We want to make sure that there's inclusion of individual and group identities. Language is a big part of culturally sensitive care. It's okay to ask for a therapist who speaks the language that you would like to be more comfortable in. The LGBTQIA+ population, having a therapist who understands you, recognizing and respecting from a culturally competent approach. So us therapists, we want to be able to respect client beliefs and values, racial, ethnic components, religion, and really just you as a human, right? So the last thing I wanted to say though, it's okay to shop around and be curious. A lot of times, like it was mentioned earlier, I've been there, I did it once, it didn't work for me, I don't want to do it again. And really being able to find a therapist that you connect with and that you are able to speak to and feel accepted and non-judgmental. So it's okay to shop around and be curious. And finally, Thrive's numbers at the bottom. If you have any other questions, please feel free to give us a call. We will be more than happy to answer any questions that anybody has.
Well, thanks to our wonderful panel for an incredibly informative discussion. There's just so much there. And I'm assuming that if people wanted to see this presentation again, it'll be up on the Thrive, in the Thrive library of talks that we've been, that you can access from the Thrive website. So all this PowerPoint and all that information will be there. There is a question from somebody. It says, where do you find walk-in services referred to earlier in the presentation?
Sure.
Yeah, and what do walk-in services do?
Sure. So walk-in services can be for a variety of reasons. Sometimes we are not able to get a hold of our therapist and we just need extra support in the moment, or maybe we don't have a therapist and we need support in that moment. So at Thrive, our doors are open anytime during our business hours. A person can walk in and tell the front desk, I would like to access walk-in services. And at that time, a member of our staff would come meet the person at the front desk, and they would go to a secure private room to then talk about what is happening.
Another question that I've heard is, what do you suggest a family member or a friend does when they sense that somebody close to them is having difficulty, but doesn't seem to be seeking services or practicing self-care? Do you have some suggestions of how somebody might encourage somebody to get help?
Alexander, do you mean adult or a kid, or I guess it could be anybody?
I guess it would be, why don't we think of it more of an adult? I mean, I think in terms of children, if the parents are identifying a child, my sense is that they would seek help for that child. So, around adults.
I would say that ask, it's so often that we think that if somebody's struggling, they'll tell us if they need our help. They'll reach out to us. They know that I'm there for them. I would encourage people to still ask, to still check in, because that is a gesture in destigmatizing whatever they're feeling. There may be a lot of shame around it, or uncertainty about what's happening, right? So just knowing that you're there and that you're open to talking about it with them, I think is a huge first step.
Right.
And if you know of resources, to share them, and absolutely to refer them to a clinic where they could contact an intake coordinator or a private clinician. You can schedule a 15-minute phone consultation and just tell the person what's going on. And that's a professional now that you have on the line that could say, you know what, sounds like you're dealing with X. Let me refer you to a place that specializes in that. Or they may even say, that's my area of specialty. I think it would be helpful for us to meet for a few sessions. It's always helpful to just make that initial outreach, and whoever the professional is, they can guide you.
And I would just add to make sure that in that approach, it's coming from a place of care rather than judgment. That they sense that it is your care that is what's motivating you to have that conversation. Well, I know we're going to be out of time very shortly, and John, I was just going to mention what our next talk is. Was that something you were going to do, or did?
Yes, I was going to do that, Steve.
Okay, great. Well, let me introduce John Meister, the president of Thrive, and for your closing comments.
Thanks very much, Steve. First, I want to thank Alexandra, Heidi, and Daisy for a terrific talk tonight. There was a lot of information in the talk, and obviously very professional, and I really appreciate everything that you've all done. So thank you. The other thing that I want to remind people is that these talks are free to the public, but they cost Thrive money, and so if you have an ability to help Thrive, you can always go to the Thrive website and donate. But the last thing I want to leave you with is this is a terrific series. We have these Thrive Talks scheduled. There are 2 in the fall and 2 coming up next winter. The next Thrive Talk will be titled Family Caregiving and Dementia, Emotional Challenges and Opportunities. The moderator will be Darby Morhart. She's a PhD and an LCSW from the Feinberg School of Medicine at Northwestern University. Darby has been a Thrive Talk presenter before, and she's really terrific. The date for this talk will be October 28th at 7:30 p.m. And again, it will be on Zoom. We would love to be doing these talks in person again at the Oak Park Library, but due to the Delta explosion of pandemic, we're restricted to be doing these remote as well. So we're hopeful that we can do more of these live, but at least for the time being, we'll be doing them remote. And so please join us on October 28th at 7:30 for a presentation on the challenges and opportunities of caregiving and dementia The moderator will be Darby Morhat. Thank you for attending tonight. Steve, thanks, and Heidi, thanks, and Alexandra,
you.
thanks, and Daisy, thanks. It's a terrific talk. I really appreciate all the work that you all do. And, I hope people enjoyed the talk tonight.